Hello, good evening. Today we're going to talk about incivility in nursing. So, what is incivility in nursing? It refers to disrespectful behavior that violates workplace norms of respect and professionalism. Moving right along, we're going to talk about abstract, the purpose of the paper, the introduction, the arguments, the conclusions, and the references that I referred to. So considering the abstract, what is the reason of this article? The reason of this article is to explore the issue of incivility that's trending in nursing, examining its cause, manifestations, and the consequence within the clinic and the academic settings. Incivility can range from subtle acts of disrespect to obvious hostility and has become a growing concern in nursing profession. Incivility impacts not only workplace but also patient safety, staff retention, and overall healthcare quality. Therefore, this paper aims to critically analyze the underlying factors contributing to incivility amongst nurses, such as organizational culture, stress, hierarchy dynamics, and communication breakdown. So let's dive deeper into the topic. What is the main purpose or focus, and why is it important to be aware of the topic on incivility in nursing? This is because uncivil behavior diminishes self-confidence. Furthermore, it hinders learning process and negatively affects students' potential to grow. So we're going to explore the issue. What is examining the causes, manifestation, and the consequence. So we're going to present three arguments and explore each one at a time. So let's discuss the scope of the paper. The scope of the paper is to analyze the incivility amongst nurses in various healthcare environments. This includes a healthcare facility and the educational institute where a student would get their education through nursing career. It will also consider incivility from patients and other healthcare professions towards nursing. Emphasis will be placed on evidence-based approaches for fostering civility. This can be achieved through policy development, leadership engagement, communication training, and institutional support mechanism. Nursing is a high-stress profession that demands collaboration, communication, and emotional resilience. This is because incivility implies rudeness, disrespectful behavior, and lack of regards amongst team members. This unprofessional behavior leads to negative outcome, decreased employee morale, reduced productivity, and high turnover rate. According to the Bureau of Labor Statistics, over the 2021-22 period, there were 57,610 non-fatal cases of workplace violence that required a day away from the work. Job restrictions of transfer, which occurred at an annualized incident rate of 2.9 cases per 10,000 full-time equivalent employee. Therefore, addressing incivility is not only a matter of ethics, but also essential for student success. Workplace incivility can impact the well-being of the nurses and indirectly or directly the quality of the patient care. So in contrast, fostering respectful behavior creates a safe work environment, which fosters confidence, curiosity, resilience, and it lets individuals take the intellectual risk. Therefore, civility in nursing builds trust, enhances communication, it provides culturally competent care, empathy, emphasizes active listening, and non-judgmental attitude, which contributes to a better patient outcome. So the argument one, it argues about the relationship amongst pediatric nurses, their work environment, their work attitudes, and the experiences of burnout. This was published in the year 2021 in Frontiers in Pediatrics. It narrates the quality of care that the nurse delivers is fundamentally connected to their overall well-being. So let's look at this argument. Overall security, which is heavily predisposed through workplace conditions such as burnout and a job-related stress, several emotional fatigue, a sense of detachment, and a diminished feeling of achievements are hallmark of exhaustion and can impair nurses' ability to provide compassionate, attentive, and safe care. Furthermore, chronic stress in healthcare environment that is often driven by understaffing, long shift, administrative burdens, and inadequate support further exacerbate this effect. Research consistently demonstrates that nurses with high level of burnout have an increased livelihood towards formulating mistakes, exhibit lower level of patient engagement, and have a decreased job satisfaction, all of which directly impacts patients' outcome. Therefore, addressing the mental and the emotional health of the nurses is not only essential for their own well-being, but is critical towards upholding above average values of patients' well-being and safety. So let's look at the argument number two. It talks about an article on building confidence, which diminishing stress. It is a clinical incivility management initiative for nursing students that was written by author Kim and other authors in the year 2024 that narrates about civility that involves showing authentic respect and thoughtfulness through action, the time dedicated, and the words we choose when interacting with others. It helps create a space that values diversity while working towards shared understanding. One of the examples of the dismissive nurse and overlooking allergy when a patient was admitted to the hospital for surgery. Before the surgery, the patient did mention the allergy to penicillin. However, the nurse appeared to be rushed and failed to document. Later, post-operatively, when the physician ordered penicillin, the patient suffered a severe allergic reaction. This shows how it contributed to an error when the nurse was rushed. Her lack of active listening and the failure to communicate about the allergy to the provider, as well as the provider unable to double check for allergy, led to the harm to the patient. This would lead to loss of trust in the healthcare system by the patient, increased healthcare costs, extended hospital stay, legal and ethical implications for the nurses. Since extended hospital stay could present further challenges over patients' autonomy, the quality of life, the legitimate consequence, patient safety addresses incivility amongst the nurses, which negatively impact teamwork and communication. Poor communication can lead to misunderstanding, delayed response to critical situations. Therefore, it is critical for the healthcare setting to address this issue through organizational disagreement resolution and professional conduct. A sustained reduction in clinical incivility cannot be achieved without the implementation of perfect, reliable, and harmless reporting policy, coupled through the management responsibility and a strong commitment to professionalism. Institutional support and a culture that encourages reporting without fear of retaliation are essential for meaningful changes. Presenting the third argument that talks about endorsing courteousness in nursing is not only vital for students' accomplishment and staff preservation, nevertheless, it is a fundamental towards the delivery of high-grade, humble, and secure individual address care. Civility is a core element of professional nursing practice that directly influences patient outcome and team dynamics. Each single nurse, whether in university, clinical training, or a broader community, bears a shared responsibility to model and uphold individual civil behavior. By serving as an example and mentor, nurses can contribute to a culture that honors both the arts and the science of nursing. Reinforcing civility is essential and enduring professional standards. Clinical instructors and educational managers should continuously monitor for signs of incivility within the learning environment and implement innovative, effective interventions as needed. As the incidence of incivility continues to rise, it is essential to raise awareness amongst both students and instructors. Doing so fosters stronger working relationships and helps all parties become more familiar with appropriate, respectful behaviors. So, in conclusion, finally, considering mental health and job satisfaction, incivility in nursing leads to increased stress, emotional exhaustion, job fulfillment, and currently highlighting the needs for wellness programs and supportive workplace environment to retain the skilled nurses. Next, legal and ethical implication focuses on unchecked incivility in nursing that can results into ethical violation and legal outcomes. Therefore, further requiring health care institute to be clear on policy, training programs, orientation, and compliance are met with the nursing standards. Here's my list of references that I refer to for further understanding the subject. Thank you for listening, and please do your due diligence by having an empathetic listening skill and being respectful to enhance communication and team collaboration in nursing profession.